So good afternoon, everyone.
Afternoon.
It's great to be here. I just want to make sure everyone's awake. This is giving me college flashbacks. I'm usually used to sitting over there. I'm not used to standing up here. But there are a few important highlights that I want to make sure that I pass along to this group. And so I've written a lot of them down. So bear with me, and we'll try to do some questions at the end. How are you hearing me? How's this? Microphone? Better?
You probably have to eat it. So.
Is it switched on?
Test. Not yet, test. Do you want me to just use the handheld? Yeah, sure. How about that?
That's good.
Oh, much better. Okay. Try not to do any feedback or anything.
Other one.
How's that? Oh, thank you. That's perfect. Thank you. Everybody can still hear me, right? Okay. So I work with CU at the Office of the National Cyber Director. My name is Steve Casapulla, and I'm one of the directors for cyber policy and programs. And so, again, thank you all for allowing us to come and share some of our work with you. Thank you to Josh for organizing all of this. Thank you for taking time out of your day to come and listen to us. This will be a bit more of a speech/remarks, but I'll leave a few minutes at the end for some questions. And again, I just want to make sure I hit a few points that I think are really, really important for the healthcare sector. So first, from the White House, from ONCD, we have the advantage of seeing across the interagency, across the public and private sectors. And I can say that partnerships forged among agencies and with the private sector are stronger than ever. I truly believe that. They need to be. And because while we have made steady progress in realizing an affirmative vision for a safe and prosperous and equitable digital future, there is still so much to be done. It is a critical time since the threats we face remain daunting, our defenses are not impregnable, and our work continues to evolve to meet the changing landscape. Simply put, we are in the midst of a transformational period fundamentally in our nation's cybersecurity. It is clear that a reactive posture cannot keep pace with fast evolving cyber threats in a dynamic technology landscape, and that aspiring just to manage the worst effects of cyber incidents is no longer sufficient to ensure our national security or our economic prosperity. The thing that has impressed me most during my time at ONCD, and I've been here roughly 9 months or so, and it's also given me confidence, is the collaboration I see every day across government and with the private sector. As CU touched on, the President's National Cybersecurity Strategy, published in March of last year, set forth a vision for cyberspace that realizes the Internet's potential and sets us on a footing to benefit from it on our terms, not those set by our adversaries. Not only is this the President's strategy and his vision at heart, it is truly the nation's strategy, because it was developed with our government colleagues and with leaders in academia, civil society, and the private sector. Again, back to that partnership piece. However, and this is a big however, strategies don't implement themselves. They're really just words on a piece of paper. Through the strategy, the President directed that we take the novel step of publishing an implementation plan, where we outline concrete steps the government has taken to advance our shared goals. We highlight activity from NIST, which has been talked about here. We highlight activity from other government partners, and we want to make sure that when we discuss some of these other government agencies, like the Department of Defense and their cyber strategy, we also talk about some areas you might not have heard about. So the Office of Management Budget is making sure that the federal government buys Internet of Things devices in such a secure way that they are secure by design. Again, I'm hoping you've heard that term already. We spotlight also in our implementation plan the Department of Justice's work as they partner in law enforcement, including with international counterparts, to expand diversion programs or develop new ones to keep kids from being roped into cybercrime. Again, just a couple of examples of that partnership and the work that government is doing. But there's also a lot more to be done, and a lot more as it impacts your sector. So let me zero in on how this pertains to healthcare and the public health sector. As of last month, the nation has a new policy on critical infrastructure resilience and security. This is the first update to our critical infrastructure policy in 11 years, and it's a big deal. It's referred to as NSM 22, National Security Memorandum 22. And a few highlights that I think are helpful here for this group. First, we have identified how sector risk management agencies are going to fulfill their statutory duties. This includes the Department of Health and Human Services, who you'll hear from this afternoon, and the Food and Drug Administration. Fundamental to NSM 22 is the idea of identifying minimum security and resilience requirements for each sector, including with respect to cybersecurity. We also require that SRMAs identify the tools they will use to manage risk, from regulation to grant money to market incentives, even including cyber insurance. And we emphasize that SRMAs need to reach back into CISA, the Cybersecurity and Infrastructure Security Agency, as appropriate and as the federal coordinator to address any capability gaps that they have. So what does this all mean? Mainly, you can and you should, everyone in this room, expect more from your SRMAs, the federal government, going forward. You should expect more. As they mature and as they do more to fulfill their mandates, you should expect to see more proactive risk management activities from them. Needless to say, the implementation of this new policy will be critical. And I know this is very important to all of us, but the new policy lays out specific responsibilities for the intelligence community as well, with respect to critical infrastructure, and really to the customers that each SRMA serves. Because many SRMAs are not traditional national security agencies, the intelligence community does not always have the relationships it should with them. This is unacceptable in the information age, and given the constant probing of our systems by our adversaries, that threat intelligence is sorely needed. Under this new policy, the IC will better tailor collection priorities to the needs of SRMAs and their critical infrastructure partners, and hopefully make them more effective in their defensive efforts. Finally, and I think this has probably been talked about this morning, the new policy contains several important sections on cross-sector risk. Cross-sector risk manifests itself in many ways. There can be assets that are relatively similar and found across multiple sectors. Cross-sector dependencies really are the things that keep me up at night. Water, for instance, is used in every facet of a hospital's daily operation. How many of you can run a hospital or a clinic without water, or power, or on and on with the utilities? And then there are systemically important entities, which I'm sure you've heard that term already today. These are the ones that are interconnected within the sector and perform critical functions that allow hospitals and clinics to operate. Unfortunately, and I know you're all familiar with this, but I'll give you the highlights. We just saw this phenomenon play out in a couple of ways. We have Change Healthcare, which everyone's aware of, but this was a payment processor. Change was effectively a payment processor, so a financial services company connected to a healthcare company. And it touches between 65 and 75% of all medical practices in the entire country. When it fell victim to its ransomware attack, billions of dollars in medical payments were held up. Again, I'm not telling you anything you don't know, just an example of what grabs our attention. And now, going on right now even, in London, in the UK, they are still grappling with the impact of an attack on one of their SIEs, even though they might not use that term. But it's the pathology firm Synovus. This attack has directly impacted surgeries, blood tests, and slowed down the ability of hospitals to provide care in a timely manner to their patients. We need to do a better job of mapping these systemically important entities and mitigating the unique risks that they pose. This new policy, these new policies, hopefully set us on a path to do so. Resilience is key. The overall goal is to keep hospitals open and providing round-the-clock care. There are budget concerns. We acknowledge that it's not easy to spend money on cybersecurity and prioritize this against buying new equipment or paying for new staff. But we have to. I know you all feel this way, but we have to. One other thing I want to talk about that impacts the healthcare sector, and this might be a little less discussed, but if it gets me in trouble, that's okay. It's one that I know you experience all day probably, and even if you don't realize it, but it's the technical debt that you all face as employees of hospitals and clinics. This is the implied cost of future upgrades balanced against quick fixes. Simply put, this is a reflection of the choices made to delay necessary maintenance or replacement of systems that will eventually impact an organization's operations. The technical debt that hospitals face is tremendous, and it can significantly impact your sector in several ways. I'll just go through them, please bear with me. Patient safety and quality of care. Outdated systems and poorly maintained software lead to errors, delays, potentially compromise patient safety. It's unacceptable. Efficiency and productivity. Legacy systems often lack interoperability, making it challenging to share patient data across different healthcare providers. This inefficiency can lead to duplicated tests, delayed treatments, and increased administrative burden. Back to that resources thing. Technical debt also increases vulnerability to cyber attacks. Unpatched software, weak security protocols, and outdated encryption can expose sensitive patient information. Healthcare organizations must invest in security updates to mitigate these risks. And finally, cost. Maintaining outdated systems can be expensive. Healthcare providers spend resources on workarounds, manual processes, and support for legacy software. These costs could be better allocated to improving patient care. Again, these are not easy problems. These are hard problems. They're tremendously complicated problems. As my boss, the National Cyber Director, Harry Coker, likes to say, ONCD is here to work on those hard problems. We're here to work with the government and private sector partners in order to address them. And in order to do so, ONCD is keenly focused on what we can do in partnership with state, local, tribal, and territorial governments. It's at the local level, so the rural hospital, the local clinic, the fire department, the rec center, the schools, some of the things that CU talked about earlier, where people have the most interaction with government. Yet these entities often have the fewest resources to combat cyber intrusions, even as malicious actors are increasingly targeting them. I'm always on the lookout for creative solutions to help SLTT partners, and the intersection of healthcare and cybersecurity is critical, especially as hospitals rely on digital systems for patient care. So here are some immediate measures that we talk about a lot, that we always want to just get out there as part of, ONCD's views, if you will. Education and training. We talked about that already, but I'll double down on it. Healthcare staff should receive regular training on cybersecurity best practices. Risk assessment. Hospitals must assess their vulnerabilities and prioritize security measures. Patch management. Regularly update software and apply security patches. You all know what McAfee antivirus is. Keep doing your updates. Network segmentation. Isolate critical systems from the broader network to limit the impact of attacks. Incident response plans. Develop and test robust incident response plans to minimize damage during an attack. Collaboration. Again, public-private partnerships. And finally, asset inventory. Tracking and optimizing physical and digital assets for the entire organization. These are the things that we have to do now, things that we should already be doing, and they will help secure hospitals by combining technology, training, and collaboration. These immediate actions are crucial to protecting patient data and maintaining critical healthcare services. According to the World Economic Forum, over 10 million healthcare records have been stolen of every type, including social security numbers, patient medical records, financial data, HIV test results, private details of medical donors, it goes on and on. On average, over 150,000 records are breached during an attack on the sector. That number could potentially be far higher. Health is a fundamental human right. It is the possibility of governments to lead the way in protecting healthcare. People need access to reliable, safe healthcare, and they should be able to access it without worrying about their privacy, safety, or security. We can and should be doing better. The first step is with cybersecurity itself. Healthcare cybersecurity suffers from a general lack of human resources. More people need to be trained and deployed. We've talked about that. Software and security tools need to be secure by design. This means putting security considerations at the center of the product from the very beginning. Healthcare organizations should also do more, particularly increasing their investment in cybersecurity to secure infrastructure and update systems, along with some of the other items I already covered. Healthcare organizations also need to commit to due diligence and standard rules of incident handling. But these matters are ultimately too big for individual organizations to solve alone. Governments must take proactive steps to protect the healthcare sector. They must raise the capacity of their national law enforcement agencies and judiciary to act so that non-state actors and criminal networks are held accountable. And this requires political will and international cooperation. Finally, as we conclude this discussion and my remarks, it is evident that urgent action is needed. Our hospitals, the very institutions that safeguard our well-being, face unprecedented threats. Outdated systems, limited funding, and a shortage of skilled staff leave us vulnerable. But there is hope. First, we must invest in modernizing our healthcare infrastructure. Robust security assessments, network segmentation, and employee training are essential. Let's embrace emerging technologies like AI and machine learning for real-time threat detection. Secondly, collaboration is our superpower. Again, back to that partnership thing. Government agencies, industry groups, and cybersecurity experts must join forces. Information sharing is not a luxury, it is our lifeline. Together, we can stay ahead of evolving threats. And lastly, investments matter. This is the part that's going to get me in trouble. Cybersecurity standards integrated into existing programs like Medicare, Medicaid, and the HIPAA security rule must prioritize resilience. Our hospitals and clinics deserve nothing less. In securing our hospital networks, we safeguard lives. Let us act swiftly, for a resilient healthcare system is our collective responsibility. Thank you very much. So I try not to go too off the cuff because I want to make sure I hit those important points and stay on time, but happy to take any questions if you have a few minutes.
I definitely appreciate the talk that you gave. I was just sitting back, still thinking about the policy and all, and I was wondering, how will the government physically audit the different healthcare systems to make sure that these controls are actually happening, for like segmentation, training, awareness, and all that? How are they actually going to physically go down to each just sector and say, okay, you're actually doing this correctly?
Yeah, so great question, and it's a problem or it's an issue that government alone can't solve, right? So we'll look to Medicare and Medicaid and the conditions of participation as HHS acts as a regulator to make sure that if you are going to participate in those programs, which means get money from the government to perform services, you will meet these standards. That's the first step. The second step is, some of that self-certification, best practices. This is what the right thing to do is. I mean, hospitals have to operate in a certain way that makes shareholders happy, that satisfies the board, all those types of things go into that.
Thanks so much for coming in and sharing the office. Is this the office policy? The Office of Director of National Cyber?
Which part?
The ONCD? Is this what you just spoke to? Are they policies from there, or are they policies that flow down from the White House?
Yeah, so we're the policy advisor to the president on cybersecurity. So the things I just talked about, those could be recommendations that we make, those could be draft policies that we're trying to implement, those could be things that we're trying to put into practice right now. Not all of them are published, not all of them have the president's name on them, but they are things that we talk about, ideas that we want to advance, things we believe in.
So I appreciate the talking points. One of the things that I drew out of Josh's discussion, I don't know if you were here or not, was that incentives and resources are key to empowering the cyber community. What I heard out of your talking points were that there's a significant amount of that responsibility for cyber is being pushed down to society. And the one thing that came out of President Reagan's Star Wars program was that we put so much pressure on our adversaries through the notion, the concept of of a global anti-missile defense system was that they backed down from it. And the one stick that the federal government has more than the rest of the American society is policy and trade implications. There's nothing stopping other countries, there's nothing stopping the White House from putting such pressure on other countries to go after their own cyber activists that we can't do, and we can't as a society spend ourselves into oblivion trying to defend against something that intuitively is going to have success, just like crime is. You can't stop crime, you can only mitigate it. Same thing's gonna happen with cyber, so I would encourage that maybe your office look at the root causes and go after the nation states and the individuals being used by the nation states to perpetrate the cyber war that's going on.
Yeah, I mean, great points. You make a really good argument. I will say, I don't work for the Department of State. I don't work for HHS. I don't work for the International Trade Representative. They're better prepared to speak on that than I am. What I will say, however, is what we are trying to do through the President's National Cybersecurity Strategy is push that responsibility not on individual citizens, not on individual people who live here, but on the companies and the organizations that can bear it. So those are large technology companies, large software companies, large hospitals that can make these types of investments on behalf of their patients. That's one of the key tenets of our national cyber strategy.
Okay. Any other hands? So, understanding that you don't work for HHS, I just kind of want your perspective on this. They recently put out a public call for comment on the 2016 HIPAA audits that they used to do. And it seems like they are positioning to say, hey, we may start doing these HIPAA audits again. Is that something that you would be in support of? Is that something that you would collaborate with them on to get the boots on the ground to do those audits? So, what's your perspective?
Yeah, so, you know,
They'll be here today.
they'll be here this afternoon. Brian will be here. I'm sure he'll love that question. But I will say, you know, with agencies, they're an SRMA, right? They're a sector risk management agency. So, you know, we're active partners with them on this is a good idea. Now, how do you implement it? What does it actually look like? How does it impact, you know, society, hospitals, caregivers, all that kind of stuff. So we're there with them.
We're going to ask our next speaker to start making their way up here. If I could tuck in a question, just because this crowd's more familiar with HHS than, say, CISA, it's too new, or terms like SID, et cetera, or PPD-21 and NSM-22 and whatnot. And just last week, without naming the person, an industry sector voice said, well, we don't really want to deal with CISA. It's hard enough to deal with one agency. Do we really have to? I guess as a transition, what's the ideal shared responsibility? You know, we added this out of necessity, this new agency. What's the ideal way for this room, who's less familiar with CISA, to see? We're gonna actually have a fireside chat about that, but how does the White House see that shared responsibility if they haven't read NSM-22 yet?
Yeah, so great question. And again, CISA, you know, I used to work there for 14 years, so full disclosure, I have a lot of CISA blood, sweat, and tears that I've shed. But CISA has a great mission. It's built on partnerships and information sharing. CISA has a regional network across all 50 states and all the territories. And what CISA can do is be that, again, NSM-22 talks about this, but that federal coordinator, but really they're a convener or a leverager to say, I have a problem in cybersecurity, I need help, who can I talk to, what can I do? CISA wants to be the first person that you interact with that's non-law enforcement, right? If you have a breach, call the FBI, end of story, CISA will follow in after that. But CISA wants to be sort of the steady state, resilience, you know, left of boom type of discussion that you have with their regional folks, their folks here in DC to say, where do I start with implementing a cybersecurity training program for my organization? How can I get free vulnerability assessments? I'm a water utility, what can I do with the EPA? Sure, here's the list of resources. They want to be that first conversation that you have. And again, I think Kirsten will talk a little bit more about what they do, but I think it's a very, very important mission because they are intended to be there all the time. They don't just come in and say, oh, you had an incident, this is what you should have been doing, let's try to fix this, and then they go away. They want to be that presence there that helps different organizations work on these hard cybersecurity problems.
And let's thank our second of two White House speakers.